Step 9, causes of male infertility. In this step, I will explain what can cause male infertility. So approximately in 25% of couples, the reason for infertility is linked to the male factor. And another 25% of couples, there is some mild male factor which may be contributing to infertility. Here I will give you a very simple framework to understand the causes of male infertility. So let us review the reproduction process in males. So reproduction is governed in three levels: regulation of reproduction by pituitary gland, the production of two products, testosterone and sperm, in the testes, and delivery of the sperm to reproductive tract of your partner through the reproductive tract called vas deferens. So if you have a problem in the level of production, in the level of testis, it's called testicular cause of infertility. If it happens in the level of regulation in the pituitary, it's called pretesticular male infertility. And if the problem happens after the production of sperm in the level of delivery of the sperm to your partner's reproductive tract, that's called post-testicular. So this simple three-level framework will first explain what could be the cause of your infertility, and the second is to direct the investigations and treatment towards that level. Okay, let us now go step by step to examine what could be actual causes of the problems. So first we will discuss pretesticular infertility that's linked to pituitary gland. So most common cause for pretesticular male infertility is use of anabolic steroids or testosterone, because if you use a testosterone, that sends a signal to the pituitary gland saying there's a plenty of testosterone in the system. It doesn't need to work and doesn't need to produce LH and FSH hormone. It shuts down production of LH and FSH, which shuts down production of your natural testosterone, and as a result it shuts down your sperm production. Why? Because for sperm production you need lots of local testosterone. That testosterone should be produced in the testis itself, so that concentration is 20 times higher than the concentration in your blood. Doesn't matter how much of testosterone you take, in the testis, in the local tissue, you will not have sufficient amount of testosterone, and that's why sperm production gets shut down. So in order to have a sperm production, testosterone should be produced naturally in the testis. That's why using any anabolic steroids, so testosterone first reduces your sperm production, then it stops sperm production altogether. So second common cause is a severe chronic stress, severe physical, mental stress, being severely underweight or severely overweight. So short-term stress doesn't affect your reproductive system that much, but chronic, long-term physical or mental stress does. So then another cause for that is pituitary adenoma, which causes high prolactin levels. That's not very common. And genetic condition called Kalman syndrome, where you don't produce much FSH and LH. So now we move on to testicular causes of male infertility. That's by far the most common cause for male infertility. So in the testicular cause, there are stem cells in the testes which divides and produces sperm all the time. Generally, these causes are linked to reduction in the number of stem cells. So your sperm production slows down. Essentially, the problem is in the production plant itself. Regulation is working fine. Your pituitary is producing good amount of all these hormones, LH and FSH, and there's no blockage of the sperm, but the actual production plant or testis has got the problem. So now we will examine what could be the causes for these problems. So one cause is childhood diseases like undescended testis, mumps virus, which cause damage to those stem cells during childhood. So this is why if you had understand the testes, mumps as a child, and if you have a male factor infertility, you should tell your fertility specialist. And genetic conditions called the Y chromosome microdeletion, and in the Y chromosome there is a special area which is responsible for sperm production. There's a genetic condition called Y chromosome microdeletion that can be the cause of severe male factor infertility. That can be detected by doing genetic tests for that. And the Klinefelter syndrome is also another cause for the testicular infertility. And cancer treatment like testicular surgery, chemotherapy or radiotherapy can impact sperm production significantly. And also environmental factors like industrial chemicals, radiation, increased temperature in working environment, or long distance cycling, for example, which increases temperature in the scrotum area, or working with computers for a long period of time. These are the conditions which can cause testicular infertility. So lifestyle factors, diet, smoking, alcohol, using recreational drugs, having sedentary lifestyle, these are also linked to the testicular cause for male infertility. So, and also varicocele testicular trauma can cause testicular infertility, and certain medications can also cause problem with sperm production linked to the testes. So now we'll move to the third level, which is post-testicular, where you have a problem with the delivery of the sperm. Your pituitary is working well, testis is producing good amount of sperm, but that sperm is not getting delivered to your partner's reproductive tract. That's called post-testicular, or also obstructive. So this may be caused due to infection, chlamydia infection, gonorrhea infection, or other infections of reproductive tract can cause blockage of the vas deferens, and also common cause for that is a vasectomy. And it may be due to genetic condition called absence of vas deferens. That's one of the conditions which is caused by cystic fibrosis, and due to problems in sexual health like infrequent intercourse or erectile dysfunction. So also this can be caused by retrograde ejaculation, usually due to prostate surgery or due to diabetes, where you have ejaculation but you don't produce sperm. Usually sperm gets ejaculated into the bladder, so that's called retrograde ejaculation. So you can see in the simple framework there are 3 levels for the regulation and production and delivery of sperm, and the problems are linked to one of these 3 levels, and you can quickly identify which level is the problem is, then address that effectively when you're doing investigation in treatment for male infertility.